Okay, sorry about that, guys. I'm going to start over. Welcome to Pick Dr. Osborne's Brain. We've got a live Q&A for you today. If you want to get your questions in, go ahead and type those into the feed now. I'll do my best to answer as many as I can within the hour. Try to keep your questions light-oriented. We're going to prioritize those questions. And if you missed Tuesday night's show, all about light as medicine and light therapies to enhance your health and improve your wellness, make sure you go back and watch that. We did a deep dive in different types of light and why you need sunshine and the myth of the dangers of sunshine that has been perpetuated for the past 30 to 50 years by the dermatology field. So go check that video out. A lot of important information, including how medicines can increase your risk of sunburning and can increase your photosensitivity. So all that's there. Without further ado, let's unpack today's questions. This is a comment. So I had trouble absorbing vitamin D3 supplementally, so I used a tanning bed in moderation. It worked. It absolutely will work. Vitamin D from tanning beds, the UVB spectrum of light will interact with cholesterol in your skin to produce vitamin D. So if you struggle, and many people do, they'll struggle with vitamin D supplementation. Some people have a kind of almost like a weird reaction where it makes them get headaches or it makes them hurt or develop pain. And so if you're one of those individuals that cannot take vitamin D as a supplement, highly, highly encourage you to do potentially UV therapy. You can get you a UV light box for home use. Company I like is called Spurty. They make really quality products. And they don't pay me to say that, by the way, no affiliate disclosure there, because I just have one and I think it's a great product. Now, that being said, you should also look at trying to eat more vitamin D in your diet, and where you can get that vitamin D particularly is if you eat liver on the regular, or if you also eat mushroom. Mushroom has a very rich quantity of vitamin D in it as well. So for those of you that can't supplement, consider those three things. All the nursing homes full of sad seniors. Yeah, it really is. Hospitals used to be built with solariums, which were these areas where people could go and sun, because it's all known that sunlight is such an important part of people's ability to recover and heal. The hospitals that are being built today don't come with solariums much. They come with LED lights in the rooms, with dark corners and dark halls. It's just not a great place that I would encourage anybody to heal in. So, yeah, good commentary. Let's see here. Is it possible to be sensitive to red light therapies? It's possible to be sensitive to anything. You have to take it as you respond to it. I know some people that initially, when they're trying to do red light, they either do too long of a session, and so they're more sensitive to it, and it actually can not necessarily not burn the skin like a sunburn per se, but it can have untoward effects. And so it's always better when you're doing any kind of light therapy to err on the side of caution. Do less rather than more, see how your skin tolerates it, and then adjust accordingly. So, classic example would be UV lights, where people get too aggressive with them, and these are the tanning bulbs, and so they'll burn after a 2 or 3 minute exposure. So if you're fair skinned, keep that in mind. Starting out at a minute, maybe the right amount for you, and make sure you're not standing right on the light, but give yourself a good 12-inch distance between you and the light. Typically, or whatever the manufacturer recommendations suggest, right? Usually these light boxes come with instructions for a reason, right? It's because the people that designed them and the people that put those lights in the machine designed it for a particular range. And so it's always good to follow the instruction in the package itself. Why do I have what? Okay, so what about lamps to get UV in the wintertime? Terry, again, UV lights in the wintertime, in my opinion, is a really good idea. Sperti, S-P-E-R-T-I, is a company that makes a really good product. There certainly are other companies that make them, but that's one I'm very familiar with. And again, depending on where you live, if you live north of 27 degrees latitude, you definitely would want to consider that if you have these long, kind of perpetual dark 4-month winters where it's ultra cold and you can't get outside. UV is a great way to enhance your health through those winter months. Laurie asks, why do I have white deposits in my eyes? No docs have been able to explain this. Often includes raw redness on the inside of the lower lids. I'd have to see a picture of what you're talking about, Lori. I mean, there are white deposits that we'll see sometimes in people's eyes. Sometimes there are fatty deposits that can occur in the eyes. There are certain soft tissue diseases. Sometimes we'll see soft tissue deposits in the eyes. It just depends on how. It's hard to say without seeing a picture. Let's see. I have a platinum LED panel and it burns my skin. Even at a distance, I try 1 to 3 minutes at max. I have very fair skin, direct intense sunshine. I burn at 10 to 15. How can I use an LED machine? I think first and foremost, look at your diet, Cheryl. If you're that sensitive to the light, especially like a platinum LED panel, it's very possible that your diet is contributing to your problem. If your diet is high in seed oils, if you're eating a lot of safflower, sunflower, any other processed seed oils, that will increase the potential for oxidation in your skin when you're exposed to light. You might also have an omega-3 deficiency. Omega-3 is very protective of the skin, and many have EPA and DHA deficiencies. These are types of omega-3. And so they're more sensitive or react more sensitively to light. We'll also see sometimes where people have things like antioxidant deficiencies, CoQ10, vitamin C deficiencies, copper and zinc deficiencies can make people more sensitive to light exposures. So it's not a bad idea, Cheryl, to get your micronutrient levels checked, because if you have certain deficiencies, again, those could be contributing to your sensitivity to that light therapy. I walk about 20 minutes a day in high altitude area. I wear glasses that darken in the sun. Am I getting any benefit from my eyes? Yeah, I mean, probably a little, but you're reducing the benefit by wearing glasses. You want the exposure to your eyes, and the sunglasses are going to block a good percentage of that exposure. There's now research coming out, Linda, that shows that eyesight actually improves with sunlight exposure and red light exposure. So again, if you're wearing glasses, you're not going to get the benefit of that. So I would consider possibly, again, depending on your vision, if they're vision glasses, obviously don't walk around on a mountainous trail if you're blind without your glasses, but consider if you're not and you're just wearing sunglasses to, for the sake of wearing them, then consider taking them off. Let's see here. Can it be true that normal lights, like in a hospital, emit UV light? No. I mean, hospitals are not installing UV light. One, the bulbs are extremely expensive, and it's not from a cost analysis perspective. I mean, maybe I'm wrong. Maybe some hospitals do it, but I just don't imagine hospitals doing that. And to my knowledge, it's not like a standard practice. If I can only afford one. Yeah, I mean, that's where if you can't afford lights, you might consider in the winter months, you might consider tanning. Not tanning to tan, but just using a tanning bed for the small amount of exposure, a couple of times a week can go a long way to improving your quality of life without overexposing you to high doses of ultraviolet that would burn your skin. So consider if you're not able to afford a UV in the winter months, look around you and see if you can buy some minutes. I mean, a lot of these salons will sell you minutes. So you can buy like an hour of minutes. And if you do 2 minutes at a time, you can have 30 sessions through the winter months that might really be in a more affordable way to go about doing it. Outside of that, jump outside every chance that you get. Is if you've got a day where the sun is shining and the weather's a little more temperate, get out there. Most people hide away, whether it's summer or winter. That's the kind of lifestyle that we've evolved to. Get that sunshine. That's the freest way to get it. Newbie here, how many nanometer do you recommend? I'm fair skinned with chronic acne. Nanometer of what? If you're talking about, depending on which kind of light therapy you're discussing, if you're talking about kind of like red lights, 600 to 900 is a good range. Some of these lights have multiple wavelengths that they emit. It's not just one specific wavelength. And so a good variety is not a bad idea, because again, if you think about how the sun provides it, it's a multitude of different wavelengths. It's not just one singular wavelength. But if you're talking about the reds, 600 to 900 nanometers is a pretty good range in that regard. Have you successfully healed small fiber neuropathy, and is infrared light helpful in healing neuropathy? Yes, I've seen a number of cases of small fiber neuropathy heal with the right diet and nutrition, Jay. But as far as whether or not infrared light is helpful in healing it, I've never directly applied clinically red light therapy specifically for small fiber neuropathy, so I can't speak from clinical experience about whether or not that might be helpful for you. Theoretically, it could be very helpful. Theoretically, and so, but I wouldn't make that claim, at least not from my own clinical experience. But I've seen small fiber neuropathy heal without the use of infrared light as a tool. Is light good for blood pressure and thyroid? Marilyn wants to know. So yeah, light is definitely good for blood pressure, depending on the kind of light you're asking about. For example, UV light will help your skin make vitamin D. If you can make vitamin D helps regulate your blood pressure, and vitamin D deficiency has been linked to high blood pressure. So theoretically, yes, vitamin D production by UV light could impact your blood pressure, provided you're vitamin D deficient. Now, if your vitamin D levels are very normal and very adequate, then doing extra light in that regard for vitamin D may not affect your blood pressure. There are a lot of things that affect your blood pressure, Marilyn, and but light, certainly could be one of those. Now, that being said, I would encourage you, if you're struggling with a blood pressure problem, to check out my crash course on natural ways to overcome high blood pressure. There's a lot to unpack with blood pressure, and if you want to check that video out, we can put a link up in this feed for you. I'll have Mel do that, and you can bookmark that for later viewing. As far as is light good for the thyroid, I mean, light's good for every organ and every tissue in your body. Your body requires light. Think of light as a nutrient, just like you think of vitamin C as a nutrient and water as a nutrient. Think of light as a nutrient. I take 10,000 IUs of vitamin D. Is it best to take with food and divide it into 2 doses? If you're taking 10,000 a day, you can take that in 1 dose. It's a fat-soluble vitamin, provided you're using a brand or a form that's emulsified. Because it is a fat-soluble vitamin, you wanna take it in an emulsified form to get the best absorption. So you could take a single bolus dose of 10,000 at one time. You don't necessarily have to divide that into 2 doses. Now, you certainly could divide it into 2 doses, and there's nothing wrong with that, but it's not necessary. I'm told I might be developing lupus and to stay out of the sun. What's your thought about that? I think you've been told something. I don't know. I don't know why the doctor would have told you that, unless he was putting you on a medication for the lupus that caused sensitivity to sunlight. I think it's a bad idea to tell anyone to stay out of the sun, minus a few unique situations, like somebody with severe autoimmune vitiligo or albino individuals, who would be a bad idea for them to stay out in the sun for extremely long periods of time. But those are more kind of genetic situations than rather lifestyle situations. But just because you're being told that you might be developing lupus is no reason to stay out of the sun. You need to figure out why you're developing lupus. And if you're new to my show, there's 4 primary driving factors for autoimmunity, and that's what lupus is. It's a form of autoimmune disease. There's food reactions, there's chemical reactions, there's microbial imbalances, and there's nutrient deficiencies. Those 4 categories are the 4 categorical trigger autoimmunity. And so it's, more imperative, in my opinion, that you would ask your doctor to test for those triggers so that you would know why your lupus is developing. Remember, any of you seeing the doctor, if they give you a diagnosis, the next words out of your mouth need to be, why does this diagnosis happen? Why do I develop this disease? Not what is my disease and what drug can I take, but why did I develop this disease, and how can you empower me and educate me so that I can make meaningful changes in my diet and lifestyle to overcome this disease? All diseases have triggers. Usually they have multiple triggers. So that's why it's so important to get them measured. So Marie says, hi, Dr. Osborne. I purchased the vitamin D3 bundle. Why we need to take this once a week along with the D3 liquid drops? So the bundle is designed, if you bought the Ultra D3, which is the capsules, is a 50,000 international unit capsules in one of those bottles. The way you want to do that is in the middle of the winter, if you're trying to bolster your vitamin D levels, take 3 capsules 3 times a day, then take 2 capsules 3 times a day, then take 1 capsule. I'm sorry, let me back that up. I said it wrong. Take 3 capsules a day for 3 days, then take 2 capsules a day for 3 days, then take 1 capsule a day for 3 days. That's a load. What you're actually doing there is you're loading your vitamin D. You're going to push your vitamin D levels high. And after that, you can take a maintenance daily dose of that vitamin D liquid. And so a good maintenance dose is anywhere between 4,000 and 6,000. And you can also get your levels checked, your 25-OHD levels checked by your doctor to make sure that you're not pushing it too high for too long. There's really not a huge danger in vitamin D toxicity. It's vastly overstated. I think there's really only ever been one major report of a vitamin D toxicity, and that was it's actually a nutritionist that was taking a million units of vitamin D a day for like over a year, and he started to develop muscle and bone pains. I mean, a million is a lot. We're not approaching anywhere near that amount. So vitamin D is a lot less toxic than what most doctors understand. And they get scared if your lab test goes up over 100 milligrams per deciliter. So if your vitamin D goes up over 100, they start freaking out. Most doctors do, and telling you how you're going to be toxic and how that's so dangerous, when in reality, there really aren't any reported major side effects of vitamin D toxicity to speak of. That being said, you don't necessarily need to supplement, more if you're 100 or higher. But certainly it wouldn't be something I would be like, oh no, you're toxic. Should a person be tested for yeast overgrowth before starting the yeast bundle? My husband has had autoimmune issues for 20 years, and Candida test was negative many years ago. You can also take that yeast bundle without testing. It's ideally always get tested, Bonnie, because know what you're dealing with. But there's no major contraindication for trying the supplements in that yeast bundle if it's a suspicion. But again, if you're really trying to get to the bottom of whether that's a problem and whether or not you even need to take it, it's always a better idea to test. Strange question. I tested positive for gluten sensitivity and celiac. I have chickens, hens, and all of the food has wheat and grains. I can't be around that. Do you have suggestions? You could wear a mask when you feed your chickens and gloves. You could just protect yourself from inhaling the dust from that chicken feed. You could also, what some people do is they use different things to feed their chickens. I don't know where you live. I live in South Texas. So for us, we have grass pretty much year round. So grass and bugs are available year round. We don't have to feed our chickens a lot. You can also feed chickens flax meal as an option, and you can feed them worms, bloodworms, as an option. So you might look at sourcing some of those things as food as well. Will it help with bad eczema? I'm getting tested, but skin is feeling burned. You mean, will lights help with bad eczema? Possibly it can. A lot of dermatologists will use light therapies for skin inflammation, Betty. If you have a good dermatologist, talk to them about that, about potential options of using light therapy for your eczema. My sister got a new metal knee last week and is in great pain. She is icing it. Would shining infrared light on it help healing too? Possibly. Infrared can help accelerate the production of ATP and melatonin in the tissue. Melatonin, a very powerful antioxidant that's helpful with healing. And of course, ATP is necessary for healing, Mark. So it's very possible that, yes, that would be the thing that might be helpful. Certainly won't hurt, and it could be tried. You know, the other thing there would be, I don't know if she's on any kind of pain meds, but she might also try a combination of vitamin C and quercetin at higher doses that can act as an aid to recovery. Can we put the link up for Mark on, we have a post-surgery protocol. So again, if she just had a metal knee replacement, what is surgery, right? Especially when you're installing hardware. Surgery is scheduled trauma, right? You're going to the surgeon and you're scheduling to have trauma performed on your body, and that trauma causes damage and inflammation, and your body has to heal from that. And that being said, there's a protocol we put together for supporting the healing of surgical procedures. And so we're going to put a link up for you, Mark, to share with your sister. Can store-bought red lights be helpful? You know, it depends on the kind of red lights you're buying at the store, what their wavelengths are, etc. I'm not sure I understand this question. What is it called, the name brand? The name brand of what? Be more specific for me, Yasmin, and I can give you a better answer. Does sun exposure happen when you are riding in the car with the windows up? No, the windows have UV protectants, and so no, you're not getting UV. And those windows also deflect some of the red light. You can get some red light through the windows, but it's not tremendously. I wouldn't call driving in the car with the windows up. I wouldn't apply that to my daily sunshine as a time factor. I'm using a light box every morning. How long should I light up? How often and when can I expect to see some results? Depends on what kind of light box you're using, Cheryl. If you're using just an illumination box that is like graded for 10,000 lux, those are also called happy lamps. So if you're struggling with seasonal affective disorder or some depression, you know, you might see a result in as little as a few days. You would use that box for about 20 minutes. Usually, most of the boxes like that, you place them 12 to 14 inches away, just set them on a desktop somewhere where you're sitting. But again, that's if you're talking about an illumination box. If you're talking about other types of light therapies, the answer could be different, but I'm just making the assumption you're talking about a UV or an illumination box. Dr. Osborne, you suggested coconut oil on wounds to help kill bacteria. Now, after having a hypersensitivity test done, I found I can't have coconut. What do you suggest instead? Silver, an ionized silver. We have something called ultra silver Reagan that might be helpful in that regard. But also UV exposure. Remember, one of the benefits of UV is its antimicrobial properties. And so sunlight is very, very effective in that regard. What's the most accurate way to test your microbiome for its integrity? What do you mean by integrity? The microbiome integrity, you don't, there's not like a test that says your microbiome has integrity. There are tests that assess what is in you. And one of the best ways to do that is laser-assisted mass spec. And not all these people out there doing these DNA PCR tests to assess their microbiome status. It's very misleading. Those are research tests. They're not designed to help give you a definitive answer. Do you have a recommendation for acne light treatment? Home device for face, blue and red. What brand do I trust? Not really. I don't really have a recommendation specifically, say, for acne, because most people who develop acne, it's an inside-out game. And so although light therapies can be helpful, it's Usually it's what you're eating or what you're not eating that's driving the inflammation to the skin, creating the acne. But blue light, UV light, can be very effective for acne. So too can red. So finding a machine that produces both or that has both options, and the Platinum LED does have blue and red as well. But then there are also other devices out there from other companies where they make combo lights, or they make lights in tandem. So, you know, the best thing to do is look and see what's available. I don't have a list of every brand that's out there, good or bad. But again, the brand I'm very familiar with, I have a unit, and this company does their research and has high quality product, is Platinum LED. Mary Ellen's asking, does a happy light work? Yes, happy lights do work. Again, those are the illumination boxes. So those are they don't produce UV or red light. They just actually just have a white light therapy that kind of helps emulate sunshine without the UV. Are there specific foods and supplements that cause photosensitivity? Not really. Diagnosed with non-alcoholic fatty liver as a result of gluten, off gluten now for 5 months. I have limited funds. Do I choose NAC or choline? If NAC, do I take with food? You know, it's a good question, Robert. You know, NAC will certainly support your liver. Choline also will do the same thing. I think it's hard to answer that question because the way I would typically answer it is I would measure to see whether or not a person was deficient in NAC or choline. But I think you would be good going with either one in this case if you're just trying to do something that solidly will support your liver. And as far as dosing goes, NAC, you know, 1,000 to 2,000 milligrams a day. Choline, you know, 600 to 800 milligrams a day would be a good place to start. What's the best way to get micronutrients checked? Carrie wants to know, can we put a link up for Carrie on micronutrient testing? It's intracellular nutrition analysis, Carrie. So it's actually an outcomes test measuring nutrition inside the cell versus measuring serum, which is what is typically done. Would red light therapy help with lichen sclerosis? Possibly. You know, I would say with lichen sclerosis, I would probably veer more toward UV light just on the surface, because a lot of lichen sclerosis has a fungal undertone, and UV light can be helpful in that regard. But certainly worth giving a shot. But I would say good old-fashioned sunshine when the winter's done, a lot of sunshine versus, say, a light therapy per se. When taking body force, can I take with food? Yes. Also, can I take out of the capsule and mix with water if needed? Yes, Eric, you can. If you're taking large amounts of hydrolyzed collagen, 40 grams, is it bad for digestion? Can you assist digestion if it is hard on the system? If you're taking that much collagen, you might have digestive problems because of the amino acid makeup of collagen. So that's a lot of collagen. I don't know that I'd recommend that much. Generally, people do really well with 20 grams or less of collagen in that regard. So I wouldn't recommend 40 and then using digestive enzymes. What I'd really recommend is maybe considering some other source of protein in your diet beyond hydrolyzed collagen. How do we detox environmental plastics? Well, one of the best ways is to not be exposed to them as much as possible, obviously, right, Laura? But also N-acetylcysteine, glutathione, alpha-lipoic acid. We have a formula called Ultra Liver Detox that I would encourage anyone to look at who is trying to just implement detox support from environmental toxins. If I cannot make vitamin D or utilize D, can light? I'm not sure I understand your question. It's strangely worded. You can make vitamin D, everyone can. So it's not an issue of whether or not you can make it. It's an issue of whether or not you're being exposed to enough UV to make it. Re-ask your question, and I'll do a better job, hopefully, of answering it. Been using an LED face mask, and all seems okay, except the end of my nose gets red at certain times of the day. What could be causing it? Could it be a circulation issue? Maybe. I mean, it's hard to say. You know, did the redness of your nose start after using the LED face mask, or did you always have redness occurring in your nose at certain times of the day? And, you know, and it just coincides that you also started using an LED face mask. Give me clarity and I can give you a better answer. What are your thoughts on light blocking glasses for screen time for students? Yeah, I'm more of a stoic on this one, Lita. I think students shouldn't be on computers the way we're putting them on computers, and I think, you know, students should be more. They should be getting their lessons more out of books as opposed to computers. Now, that being said, you know, that doesn't really help you answer the question. Yep, blue blocking screen settings can be set up on the computers. And some softwares can be downloaded that will block blue light emission from the computer itself. You could also do blocking glasses, but I'm more of a fan of the blue blocking from the screen. And this is more particularly true if you're trying to do studies at night or kind of in the end of the day versus, say, in the morning. So, like, remember, we want blue light in the morning. There's benefits to blue light. I don't think wearing blue blocking glasses all day long every day is a good idea. We want the blue light as well. So part of it is just a timing issue. But there's not a particular brand that I would recommend really over another, especially in light of the fact that you can set your screen for blue light blocking capacity. Are full spectrum lights useful for the body? I like full spectrum lights in my house and in my office. So as far as like light bulbs are concerned, I think they're much better. They also emit red light as well. They do have a heat, unlike these newer LED lights that are being forced down everyone's throats. Absolutely. Oh, let's see. How about combining HBOT, liposomal melatonin, and red light therapy? For what, Alvin? I mean, HBOT can be a valuable therapy for improving oxygen. As far as liposomal melatonin, I'm not a fan of melatonin supplementation. Typically, I think, you know, if you're out in the sun enough, you're going to make plenty of melatonin. And I think if you get to bed on time and eat well and make sure your diet's got enough copper and vitamin B12, you'll make your own melatonin just fine without having to supplement with it. And as far as red light therapy, I'm a fan, especially, again, considering where you live and what time of the year it is. Oh, thanks, Slim. I said, I just ordered your nutrient deficiency test kit. So excited and so affordable. Each lab separate would be unaffordable. It would be. That's why we put it together as a bundle, to make it affordable and to make it available for people whose doctors are just stubborn or ignorant about nutrition. Thoughts on red light for cancer? I don't have any experience directly using red lights for cancer, so I can't comment from experience. And I don't think there's enough literature or research that's been done on red light for cancer to make any kind of major claims. So sorry, I can't be more helpful in that regard. But I mean, theoretically, let's think about the two biggest fundamental things that red light helps to accomplish when exposure is there. It improves the production of melatonin inside the cells directly, and melatonin has some of the most powerful anti-cancer effects. It's one of the most potent antioxidants known to man. So for that reason, theoretically, we could say maybe it is helpful. I certainly don't think that it would hurt a person to use red light for cancer. So in that regard, more power to you. The other thing that red light therapies do or can do biologically is increase the generation of ATP. So it actually, in that regard, is some research now showing that red light therapies actually reduce blood sugar. And of course, many cancers can be fed by excessive sugar. So again, we could make some kind of theoretical leaps, but I just don't think there's anyone who's done enough research on okay, do you justify this amount of red light therapy at this wavelength specifically for cancer? But I don't think there's any risk or any danger in using red light as an adjuvant to just trying to be healthier. Does red light help hyperpigmentation on the face or make it worse? I haven't seen it make it worse, and I don't have any experience with it helping. Regarding the redness of the tip of my nose, I didn't notice the redness immediately after using the mask. I usually notice it's red at the end of the day. So again, if it's not mask related, there could be a number of issues. I mean, it could be a circulation issue. You could also have, kind of the beginnings of rosacea. Let's put up for JoJo if we can. We have a link to our show on skin, and this may help you kind of go down some different rabbit holes about why that might be happening. Recent Weston Price article recommends not taking any vitamin D supplements. I can't really comment on it. I haven't read the article or the justification behind that recommendation. But I would just argue as a practitioner who's seen over 10,000 patients over the last 23 years, I disagree wholeheartedly. I've seen vitamin D supplementation do amazing things for people, and I'm also a realist. I know in a perfect world, if a person was getting regular sunshine on a daily basis and eating a lot of the rich fatty foods and organ meats that might contain vitamin D, that in that perfect world, we would maybe not have the great need to supplement with vitamin D. But the reality is that's not the world we live in. So I think that article, again, I can't really comment on it beyond that. What do you think about ultrasound electromagnetic machine for joint problems and pain? If you're talking about a pulsed EMF, like pulsed electromagnetic frequencies for helping the body heal and repair, I think PEMF is a good. There's a lot of science behind it, and there's a lot of good benefit that can come from it. But I'm not sure if that's what you're talking about. Is ultrasound, which is there's ultrasonic therapies as well, where you have sound waves being pushed into tissue to help break up adhesions and increase and improve blood flow. That's ultrasound, and you have pulsed electromagnetic therapies, which just resonate a wavelength into the tissue that can help with healing, help support healing. So, which are you talking about, or are you talking about both? Can NAC chelate good nutrients and vitamins? No, I haven't seen any solid research on NAC actually pulling out things like calcium, for example, or magnesium or zinc. And I've not experienced that either. And I've used NAC for decades and not seen a correlation between high dose NAC therapy and, say, somebody developing calcium or magnesium deficiencies or other minerals. Is there an optimal level of vitamin D, or is this different for everyone? I keep my levels around 75. I have RA. My experience, Nancy, with anyone with autoimmunity is to try to keep that D between 70 and 100 as a range. Certainly everyone's different and unique, but if I'm trying to generalize and answer your question, between 70 and 100 is a pretty good place to be. Is red light therapy good for the gut? What about candida overgrowth? Studies seem promising. Don't have any experience on using red light for something like a candida overgrowth. As far as whether or not it's good for the gut, I think, again, we can apply the fundamental basis of the chemistry behind what red light therapy does. It improves melatonin production, improves energy production. So in that way, it can be good for any tissue or supportive of any tissue. Can I eat seaweed snacks? I don't see why you couldn't. Is there a reason why you think you wouldn't be able to? Is Pectisol high in oxalate? I don't know. It's a supplemental thing, and it depends on the product and the manufacturing of the product. So you might be better off getting that question answered by contacting the company that you're buying it from. can you use red light if you have melasma? I've not seen cases where people using with melasma have reacted poorly to red light, so I wouldn't see an issue there. But if you're concerned about it, approach it slowly and with caution. Is ghee okay to eat if you are gluten sensitive? I don't recommend any dairy. You know, going back to No Grain, No Pain, my book, No Grain, No Pain, we don't recommend dairy because of its gluten mimicking properties. That being said, there are exceptions, and a big part of those exceptions depend on the length of the time frame of which you've been gluten-free and the type of ghee that you're referring to and what kind of animal it's being made from and how the animal was fed, etc. Is gluten in detergents likely to be the reason for urticaria? I was exposed to it at work in my teens, and it spread from my hands to the body when I got out into the sun. I also got sunspots. Possibly. I mean, look, the reality is if your skin is inflamed and you put gluten on it, the barrier of the skin has been breached. You know, the old saying in dermatology is always that gluten is too large of a molecule. The molecular weight is too large to penetrate through the skin. But if you have pre-existing inflammation on your skin, that takes that away. Right now, gluten has the ability to penetrate through because your barrier's leaky, so to speak, or breached. So certainly I'm always cautious about gluten being in products, even topical products like soaps, shampoos, lotions, detergents. So definitely would encourage you to avoid it if you are gluten sensitive. Question about calcifediol. The best form of supplemental vitamin D is cholecalciferol. That's vitamin D3. Now, some would argue, and many medical docs will prescribe vitamin D2, ergocalciferol, which I'm not a fan of because the body has to do work to activate it. More work to activate it. It's just not something that generally I recommend over vitamin D3, cholecalciferol. So Mara's asking about doing intracellular testing in Holland. If you wrote Malaya and didn't get an answer, rewrite her. Write her again until she gives you an answer. There's an old saying, the squeaky wheel gets the grease, Mara. And I'm sorry that she didn't answer you at this point, but write her again and write her every day until she gives you an answer, and I'll give her a nudge. What's your opinion on eating lots of red meat in a metabolically healthy person? Good or bad for longevity? I'm a fan of red meat. I like red meat. I eat red meat several times a week, multiple times a day. I don't think there's any great scientific evidence that shows that eating red meat is necessarily contributory to any kind of disease. I think there's a lot of vegan rhetoric filmmakers that love to demonize red meat. And I think that there's an agenda in our country to get everybody to eat bug protein and and eat plant-based protein because it's super hyper profitable while simultaneously creating illness in people. But I don't think that eating God's good, wholesome red meat from healthy animals who are being maintained in an ethical way and raised in an ethical way is a problem at all for health. Now, that being said, you can overdo anything, right? And so is there a possibility of a limit? I think that's based on individual case-by-case basis, but I'm not necessarily a fan of all the rhetoric out there that tries to demonize red meat as somehow dangerous or evil for health. Did we put the blood pressure link up for Carrie, Mel?
Yes, probably did.
Okay.
Yeah, I tagged them.
Do LED lights from light bulbs being sold now harm brain function? I don't know, Joshua. I don't have an answer to that question. I think some could make an argument that they're not the healthiest way to light your day, but I haven't seen anything definitive on researchers actually showing that it's directly harmful for brain function per se. Regarding Candida fungus protocol, I had listened to Dr. Michael Biamonte video. He said that vitamin D3 and B complex could interact with the protocol of cleaning Candida. Is that true? Well, look, yeast produce their own vitamin D, so I wouldn't suspect it taking. Well, I've never seen clinically. I put people in their Candida protocols all the time on vitamin D and B complex. So I would argue that's maybe a theory that he has. Whether or not he's seen some kind of negative response in his own patients, I can't comment. I don't know who he is, but it's not something that I would say is a huge problem that I'm concerned by. Remember, the yeast typically they produce their own ergocalciferol, which is basically they produce a cholesterol, an ergosterol that absolutely helps them produce their own vitamin D. So whether they're interacting with your vitamin D from your own diet, I'd say is conjecture and up for debate. Anne Marie says, "What can you tell me about megadosing vitamin therapy? What kind of vitamin therapy? Got to be more specific than just megadosing vitamin therapy. I think megadosing of certain vitamins is very much applicable for many reasons, depending on the individual and depending on the situation. The original name of megadosing vitamin therapy is called orthomolecular medicine. And so ortho meaning correct or right, and molecular meaning molecule. So using the right molecule in the right situation at high enough doses to overcome problems, orthomolecular, which is, again, the kind of the technical way to say megadosing vitamins. I had Borrelia 8 years ago, treated with antibiotics and able to work 6 months, same repeated 4 years ago, and now neurologist doesn't think it's Borrelia, don't know what it could be, on amitriptyline for pain. Is that good? I would say you haven't found the answer, Eric. If you were told that you had Borrelia and you've been struggling for 8 years and you're still struggling and they're wanting to do more medications, you haven't figured out what's actually wrong yet. So there's homework to do. You got to find a doctor who's willing to help you do that homework. Will red light therapy help with arthritis? Yes, absolutely it can. It's one of the indications that I've seen red light do really, really well with. As well, there's some pretty good research on that. What are your thoughts on spirulina and chlorella? I think they're fine, in certain situations or cases, but I don't think it's something that a person needs to have to take every day or consider to be a kind of a top tier supplement where this is something you need to do on an ongoing basis. If I go outside on a sunny day in the winter and I'm wearing a coat, will I get the benefit from the sun? You won't get the UV exposure to your arms or chest. You might get some to your face if you're not covering up your face. So there will be UV benefit in the face. And the red spectrum of light will penetrate. It can penetrate through clothing. So you may get some of the red light benefit in the winter months. It's definitely worthwhile going outside even in the winter with clothes on. Any experience positive results with drinking hydrogen water for healing the gut and therefore correcting candida? Absolutely zero. I would not use or recommend hydrogen water as a means to heal. I think there's a lot of overreach on what's being said about hydrogen water. It's not to say that there aren't anecdotal stories out there of people finding it very helpful for them in their own unique situations. But if you're trying to prioritize what you should focus on trying to do to heal your gut, it's not hydrogen water. And it's your diet change, and that's true of anything. If you haven't changed your diet and you're looking for therapies that are passive therapies to help correct your bad behavior, you're never going to find an answer. So don't look for a magic bullet in any product, and whether it's hydrogen water or a supplement. This is a monster question here. It's a great question. Could near-infrared laser diodes, 800 nanometers, be used to irradiate the skull, the front cortex, to stimulate neurons to develop ATP and synthesize melatonin in neurodegenerative disease? I think it's very sound in theory to say yes, but don't know. Can't answer that question. I've never applied that clinically, so can't speak from any kind of clinical experience with that. But certainly worthwhile doing. Again, I don't think red light therapy has any major contraindications, but the upside could be great. And so that's one of the things when you're thinking about should I or should I not do a thing, you want to ask, well, what are the risks and what are the benefits, right? And so if the risks outweigh the benefits, obviously the answer in your mind should leap to probably a no. If the benefits outweigh the risks, then it's definitely worthwhile. And if you can afford it and the cost is not one of the things that is calculating in your risk and it's affordable to you and there's no downside, then certainly it's worth a try, because neurodegenerative diseases and the medical treatment model frankly suck. I mean, there's no great treatment out there for neurodegeneration outside of diet change, but part of that depends on how long you let the neurodegeneration go on before you apply diet change. Because if you can apply diet change early on in neurological detriment, you can do a lot of reversing of problems. But if you're waiting late in the game and you've already developed major symptoms and major neurodegeneration, it's a lot harder for diet change to aggressively lead to any promising outcomes. So the key in my experience with neurodegenerative problems and processes is get it early, don't wait. Is bamboo flour safe to ingest if it is gluten-free? Yeah, I mean, I'm not opposed to it, but bamboo flour is used nowadays. It's been being used as a filler in a lot of supplements. Haven't seen any major issues with it. What do you think of infrared saunas for the body? Good, bad, indifferent? I think they're fine. I think infrared can be very effective and very powerful at helping people recover and helping people eliminate toxins through their sweat. And I think for many, just the therapy of the heat therapy of the sauna itself can be very beneficial at improving blood flow and reducing pain, musculoskeletal conditions. Can I take a probiotic with oxalobacter to replenish my gut flora? There is no probiotic with oxalobacter on the market that I'm aware of. So to answer that question, no, because I don't think one is commercially available to purchase. Having trouble finding a vitamin supplement that's gluten-free and soy-free, is there one you could suggest? For what, Mercy? Are you talking about like a multivitamin? If you are, check out either Ultra or Multi-Nutrients. We'll put a link up in this feed for you on that. They're both gluten and soy-free. I have a genetic skin disorder called ichthyosis. Is there a link between gluten, between it and gluten? I've also seen videos on YouTube that claim carnivore diet cured them. Will red light therapy help with ichthyosis? So it's 3 questions. I haven't seen any major literature or research on ichthyosis in a gluten-free diet, although I've seen cases of this type of problem clear up with a gluten-free diet. And it would make sense to me if you've seen anecdote on YouTube of carnivore diet clearing it up as well, because a carnivore diet is gluten-free. As far as whether or not red light therapy will help, it's potentially possible. I'm a big believer more in light therapy as sun, right? Sun providing a full spectrum of light as often as possible to skin tolerance as a means to be healthy. Wondering if you have an idea why I feel better on clear mornings indoors than cloudy days. This is when there's been little to no time outdoors. So there could be shifts in barometric pressure that are affecting you as far as the clear mornings versus the cloudy. It could be a number of things. It could be quantity of mold spores. Usually on cloudier days, there's more moisture in the air. Can be potentially more proliferation of mold, and you might have mold reactions or mold allergy or sensitivity that is worse on those cloudy days as well. So, a couple of things to think about there. Can you use legumes during a candida therapy or sweet potatoes? Sweet potatoes, yes. Legumes, I don't recommend, Mara. Is taking 50 milligrams of melatonin every night for overall 3 months too much? Only dosage which works for me to fall asleep for over 4 hours a night. Is there a dosage which is poisonous? 50 is a lot. I mean, we usually start people on like 3 milligrams and you're at 50. It's a lot. Is it too much? I mean, one would argue the benefit of sleep outweighs the potential risk of 50 milligrams of melatonin, but I would also say this: you need to figure out why you're not sleeping, and supplementing with 50 milligrams of magnesium or melatonin rather is not why you're not able to sleep. There's a deeper problem you haven't determined. So you really need to get with a good doctor to help you understand the biology of why you're not sleeping. And there are a lot of things you might watch. Actually, I'd encourage you, maybe we put a link up for Joshua on our sleep class and just go through that class and do a deep dive and just see, are you checking off all the boxes, or are there things that you're not doing that might potentially help? Does red light or UV light therapy help with foot fungus? Yes, it can. UV light specifically. One of my favorite things for foot fungus is to have people get sunlight exposure. In other words, walking barefoot outside in the sun. But also UV would work, as well as soaking that toe in peroxide. Anything about biomats? Are they a good source for infrared therapy? Biomats, I don't know which one you're talking about, because there are different kinds, and some of them are pulsed electromagnetic frequency mats, and some of them emit heat. So I'm not sure, Nancy, which ones you're talking about. I keep reading that magnesium stearate will block nutrient absorption. Is this true? No, it's absolutely not true. Magnesium stearate is perfectly fine as an added ingredient. Stearates are basically a form of fat, and magnesium powder so they use magnesium stearate as what's called a flow agent in a lot of products. And the reason why they do that, Lorraine, is because when you're blending powders, it's different than when you're blending liquids. If you're blending liquids, generally they'll mix well together. But with powders, because they're in a solid form, you need flow agents to make sure that when you're capsulating a supplement, that you have an equal amount of whatever it is you're trying to make sure is in each capsule. And flow agents help to homogenize the mixture. And so magnesium stearate, perfectly fine, does not cause malabsorption. It's not dangerous to take. There was a doctor or two a few years ago talking bad about it. And it's just rhetoric. There's no evidence and there's no scientific truth to magnesium stearate being a problem. Is topical melatonin good for hair growth? I've heard it's a new protocol. Look, all this nonsense about rubbing stuff on your head, I think isn't just that. I think it's nonsense. I think if you're going to get good hair growth, as long as you don't have an autoimmune hair disease, or as long as you don't have some type of androgen-related hair loss or male pattern baldness hair loss, I think where most women struggle with hair growth is they're under eating calories, they're under eating protein, they're overstressed, and they're malnourished, or they're eating foods that are driving an autoimmune inflammatory process around their hair follicles. And if you deal with those things, you don't have to worry about slathering up creams and lotions and hoping for the best. Can jerking movements in the hands, fingers, and legs while falling asleep be a sign of neurodegenerative disorder? No, that's very typical of people falling asleep, is the nervous system being stimulated and having a kind of a reflexive jerk. So no, that I would not, if you're having that happen sometimes, not something I would be really worried about. What's the best alpha lipoic acid brand? Can you put up a link to alpha-lipoic acid for Vanya, please? Is having UC ulcerative colitis, why do I feel better under warm yellow light than the bright white light? Probably because that warm yellow light is doing what it's increasing your blood flow, it's improving your energy generation, and it's increasing melatonin production. That warmth may also help you feel better, because warmth is sometimes a tool that we use. Warm is what we use for pain reduction. So depending on, if you're feeling better because you're talking about pain in your bowel or pain in your gut, hard to comment, because I'm not sure what kind of symptoms are feeling better for you in that regard. Yeah, comment on B12. I take it from a reputable company, but it contains xylitol. Yeah, I mean, xylitol, most xylitol is derived from corn fiber, which I don't recommend, Robert. If you want to take a B12 lozenge, use methylcobalamin. We have natural cherry extract in it. And the xylitol in ours is actually birchwood. And it's organic, and it's done that way on purpose. Years ago, when I was trying to find B12 lozenges to support my patients, that was one of the biggest struggles, because we wanted them to be grain-free, and we didn't want them to get corn-based derivative in their product, and couldn't find one. There wasn't one actually on the market, so I actually ended up having to design my own, and so that one's you can trust. Okay, I did stop all the grain. Stopped with all the grains after 13 years, where I didn't even think about it, and I do feel so much better thanks to you. It's kind of hard to figure out how to make some new combinations. Not a question, more of a comment. Well, I'm glad you stopped it, and I'm glad you feel better. Is it true that if I can't take certain vitamins, it's because I have a shortness or a deficiency of vitamin B3? No, not true at all. One of the biggest reasons people don't tolerate B vitamins, especially certain methylated B vitamins, has to do with mold exposure or other environmental toxic exposures. So I wouldn't suspect a B3 deficiency driving that at all. Is allulose corn derived, or does it really come from raisins and figs? We're waiting. Corn derivative allulose, which is something I would say be cautious about. So, again, I would suggest you call whatever product it is that has allulose that you're using. I suggest you would call the manufacturer, inquire directly from them where their source is coming from. Okay, we're an hour and 7 in. We're going to call it a day. Thank you so much for tuning in to Pick Dr. Osborne's Brain. If you didn't get your question answered, come back next week. We do this every Thursday at 12:30. If you're new to the show and you want to get some great free information about overcoming autoimmunity and improving your health, come visit me at glutenfreesociety.org. Sign up there for our newsletter. It's absolutely free, and we'll send you a whole bunch of wonderful information on how to navigate diet change and create fantastic health. Also, make sure to do me a favor. Our goal here is to save 100 million lives. And those of you that saw the post earlier this week, we hit 20 million views this past week. Thank you for all of your viewership and all of you that are watching. Keep spreading the word and spreading this information and sharing it with people you love and care about, because together we can reach 100 million lives. Thanks so much for tuning in. We'll see you next Tuesday at 6 p.m. and again next Thursday at 12:30. Take care.